What are the best foods to eat if you have PCOS? Hi everyone, my name is Dr. Besma Faris and I'm a board-certified OB-GYN with an expertise in PCOS. Remember that this video is for education only and is not intended to be medical advice. Before we get into the specific foods, it's important to understand that a PCOS diet is focused on improving insulin resistance. Insulin resistance is very common in people with polycystic ovary syndrome. It affects up to 70% of patients and 90% of those who have PCOS and obesity. And it plays a major role in both the metabolic and reproductive problems seen in this condition. Luckily, managing diet is one of the most effective ways to improve insulin sensitivity, lower risks for diabetes and heart disease, and support better menstrual and fertility outcomes. So when it comes to diet and PCOS, what does the research show? Research shows that several eating patterns can improve insulin resistance and help with weight loss in PCOS. The diets with the strongest evidence include Mediterranean diet, a low glycemic index diet, the DASH diet, which stands for Dietary Approaches to Stop Hypertension, and a ketogenic diet. These diets are all linked to improvements in fasting insulin, body mass index, waist size, and markers of insulin resistance. However, experts stress that no single diet is best for everyone. The key is choosing a plan that is realistic and, most importantly, sustainable. Now, let's get into the specific foods that are good to include in your diet. One of the best food categories for PCOS and insulin resistance are high fiber foods. This includes whole grains like oats, barley, quinoa, beans, vegetables, and fruits. Fiber helps control blood sugar and weight. Healthy fats can also be a good choice. Olive oil, nuts, and fatty fish like salmon, sardines, mackerel support metabolic health and reduce inflammation. Choosing to eat lean proteins is also a smart decision. Fish, poultry, eggs, beans, and low-fat dairy help to keep you full and preserve muscle during weight loss. Patients often want to know if they can eat carbs when they have PCOS. The answer is yes, but you need to be strategic about it. You'll want to choose low glycemic carbs. These include whole grains, starchy vegetables, and fruits with lower sugar. These can help prevent blood sugar spikes. What about foods to avoid if you have PCOS? These include refined carbs like white bread, sugary drinks, processed snacks, and fried foods which contain unhealthy fats. How often and how much you eat with PCOS also matters. Eating smaller, more frequent meals and making breakfast the biggest meal of the day may help with blood sugar and weight control. Long-term success also depends on behavioral support, such as setting realistic goals, self-monitoring, and getting regular guidance from a healthcare professional. When it comes to diet types, the Mediterranean diet is often easier to follow and provides broad benefits for heart and metabolic health. The ketogenic or very low-calorie diets can cause quick weight loss and improve insulin resistance, but they are hard to stick to for the long term. What questions do you have about PCOS? Leave them in the comments and I'll do my best to answer them in a future video. Hope you found this helpful. Remember to hit like and subscribe below, and I'll see you in the next video.